So hello, my name is Lucía Babiano Espinosa, and I'm here to tell you about our project, which is ECBT for children and adolescents with obsessive compulsive disorder. So the components of our team, the leader of the team is Norbert Skokauskas, and then we have Bernard Weidel, Lidewig Walter, she's from Amsterdam, Stian Lidersen, Scott Compton, who is from the US, and me, the PhD candidate, Lucía Babiano Espinosa. All of them are my family of supervisors for my thesis. So what is OCD? It's a chronic mental health disorder that is characterized by recurring obsessions and irresistible compulsions. There are many concerns that patients suffer, such as contamination, symmetry, concerns on safety, on catastrophe, on intrusive sexual thoughts, illness obsessions, etc. So those obsessions and those concernings normally are very harming for their everyday, and don't allow them to have an adaptive life, often making them wish they could actually overcome them. That's why they come to therapy. So it responds to what we call a vicious cycle, where the obsessions bring up anxiety, and in order to find some kind of relief, they have to do those compulsions. And then as they repeat the cycle over and over and over, they become trapped. So we need somehow to break this cycle. How do we break this cycle? For this, we have different tools. One of these is CBT, cognitive behavioral therapy. And also sometimes we use it in mixture with medicines. So for cognitive behavioral therapy is the gold standard treatment with the help of medicines. And there are many publications on how this is the best way to treat OCD. So the thing is, traditional CBT has to face many barriers, such as geography, stigma or shame when they come to treatment, lack of resources, availability, or maybe in the case of children that it may not be a very appealing treatment. So we are trying here to overcome those barriers. So using the new technology we have, why not to just enhance it? So we have developed an application for the children and the parents, a web for the therapists to control those applications in the cell phone, and we also have video teleconferencing sessions with the patients. In that application I was talking about, there are many things you can find. One of them is psychoeducation. The children have access to videos on psychoeducation on OCD in their hand, and they can watch them as many times as they want with the parents. They can come in session and they can ask us questions about what they have seen in the video, etc. Other thing they have in the app is the symptom list. So normally when children come in session with a therapist, they make a list with the symptoms that are the biggest issues. And they normally score them and have the 3 most important on top. So this way, it's a nice way for them to have them again in their hand, and also to add more if they find out about more symptoms. Then in between sessions, the cognitive behavioral therapy is about, one of the components is the ERP, which is the exercises they do in between sessions. So as often happens with children and also with adults, we forget about our exercises. So this is a very nice way to receive notifications, to remind you which are the exercises you must do, and also to have control on those. And then in the graph here in results, they can see their progression. So after doing exercises, they will tell us how hard was it or how stressing was it for them to do this exercise. So they will be able to see the progression in therapy, which is also quite motivating. Then the therapists in the site, they have a website, and in that website they are able to control these exercises, put new exercises, to add new symptoms to the list, to add notifications so the children don't forget about the exercises they must do, or when they have to come to session, or whether there is a new exercise. And then another of the nice features we have is that we use video teleconferencing. For this, we use an encrypted program, and this is very nice mostly because there are many exercises that might not be so hard in office, but what about doing them at home? So what we are ensuring is that the children are also able to do the exercises at home and in any other place. So for example, if there is some problems with heights and going to the tallest tower in Trondheim, we can follow them with the phone thanks to video teleconferencing, or whether there is an issue at home in their own bedroom where the sacred place where no one should spoil it or no one should make it dirty, we can also expose them to exercises at home. So what is all of this for? So we are actually producing knowledge thanks to this, and we are already treating patients We have treated 15 patients so far, and this will constitute 3 articles for my PhD thesis. So the first article is a systematic review. It has already been submitted, and it has been presented to a conference, an international conference in Prague last summer. And this is the flowchart, which is how we explain how many articles we started with, and we ended up with 6 articles on the topic. And then the second article, which is the one we are working right now on, is a case series. We test the efficacy, the acceptability, and the feasibility of the features we just talked about. We have collected 9 cases so far, and right now we are analyzing the data and writing on it. And then the last article that has not been started yet will be an efficacy trial. And what we will do is to compare all of those cases we are gathering with efficacy, accessibility, and feasibility, and we will compare it to Nordlost, which is the Scandinavian study they made on face-to-face therapy for OCD. So basically that's our project. It's been a long time and very hard work and very exciting, and we hope to make it up to the top of the mountain.